So we want to talk about an effect that surgery has on blood vessels. That's you do the surgery, okay, and surgery usually has this effect on blood vessel by destroying their lining. So that lining is what is known as the endothelium. Do you understand? So it could be destroyed during surgery. So I want to actually look at this, endothelial injury. So I want to actually look at this, okay, and its effect. So endothelial injury during surgery just refers to, damage to the inner lining of blood vessels, and it's usually caused by what? Surgical trauma, ischemia-reperfusion, and inflammatory response. So this injury disrupts what? Vascular homeostasis. Like, it disrupts how the blood is flowing in that blood vessel in peace. So instead of you having a smooth flow, you are now having a turbulent flow. Do you understand? It also impairs microcirculation, can also contribute to post-operative complications, like somebody is having blood clots in blood vessels after an operation. So why endothelial injury matters is the endothelium role. The endothelium is more of like, this wall of the blood vessel. So the smoother it is, the less problems you have. Do you understand? So it regulates vascular tone, blood flow, and coagulation and immune responses. So if there's a trauma to it, it can compromise that endothelium integrity. Do you understand? So I have the visual triad. We said that the endothelial injury is one of the three pillars that predispose to thrombosis. So mechanisms of injuries: you can have direct trauma, you can have ischemia-reperfusion injury rather. That one is a temporal disruption to the blood flow followed by restoration. But if there's a stoppage in it, then followed by continuation, it triggers oxidative stress and inflammation, right? So there could also be inflammation. There could also be what? Microcirculatory impairment. So clinical consequences: this can actually lead to blood clotting, poor tissue perfusion, organ dysfunction. All right, like if there's a blood clot towards any organ, let me say the kidneys, the heart, all those important organs to us, then you can now you can have all those issues. So I think that's what we have, okay, and its consequences.